Hello everyone, I'm Dr Dipti and today we'll discuss about thalamus. Now, thalamus, as we all know, it is a major part of diencephalon. Okay, this is diencephalon, which includes thalamus, subthalamus, hypothalamus, and epithalamus. This is here thalamus, which forms 80% part of diencephalon. So, thalamus, it is large ovoid masses of gray matter. You can see here they are present in the upper part of lateral wall of the third ventricle. You can see here, these are two lateral ventricles. This is third ventricle. So in the lateral wall of the third ventricle, we have this thalamus. It is situated bilaterally in diencephalon. 80% of diencephalon is formed by thalamus. Cephalic part, you can see here, cephalic parts of the thalamus, they are connected through massa intermediata and caudal parts are separated. Now, we'll discuss nuclei of thalamus. Nuclei of thalamus, they are divided by two classification. One that is anatomical classification, second is functional classification. So first we discuss about anatomical classification of nuclei of thalamus. So first of all, this nuclei are majorly divided in three groups. One is anterior group, medial group and lateral group of nuclei. Okay, so lateral, medial and anterior group. Now we'll discuss. Suppose this is your lateral, you can see here, this is the diagram. It shows lateral group of nuclei. This lateral group, it is further divided into ventral and dorsal. This is ventral and this is dorsal. Ventral again has ventroanterior, ventrolateral and ventroposterior group. Ventroposterior again is divided into ventral posteromedial, ventral posterolateral. Okay, and dorsal group includes lateral dorsal, lateral posterior and pulvinar. I repeat, all the lateral group of nuclei. Lateral group is divided in ventral and dorsal, ventral further divided in ventroanterior, ventral lateral, ventral posterior, ventral posteromedial, ventral posterolateral, and dorsal group is lateral dorsal, lateral posterior and pulvinar. And in ventral group, we have medial and lateral geniculate body. They are the part of the pathway of medial, that is a part of the pathway of auditory impulses, and lateral for the visual impulses. Okay. Now we will discuss in detail. Then next is anterior group. Anterior group has no further division. Anterior nuclear group, this one. And medial group, again it is divided into centromedian, here centrally, dorsomedian and midline here. Centromedian, dorsomedial and midline nucleus. Okay. Now we'll discuss functional classification. So this was anatomical, this is physiological. Functionally or physiologically, nuclei are divided in two groups. One that is non-specific projection nuclei. Their projections are not specific. And second is specific projection nuclei. I'll discuss. So non-specific projection nuclei means this nuclei, they receive impulse from reticular formation. Here it is in the brainstem. So from reticular formation, impulses are given to this non-specific projection nuclei, and through this impulses will be given to all parts of the cerebral cortex. And this non-specific projection nuclei are midline nucleus and centromedian. Anatomically, we have already discussed them in the medial group. Okay, midline and centromedian. These two are non-specific projections nuclei. Okay? Then specific projection nuclei. Specific projection nuclei are specific sensory relay nuclei, means sensation they relay through this nuclei to particular area of the brain. Medial geniculate body, as I told you, that is specific sensory relay nucleus for auditory pathway. Okay, so it receives impulses from inferior colliculi and then this will be given to the cortex auditory area. Lateral geniculate body receives impulses from the visual pathway. It is the part of the pathway of visual track, optic tract. Then ventral posterior nucleus, it is further divided into ventral posterolateral, ventral posteromedial. Ventral posterolateral nuclei, all the ascending tracks we have discussed, they pass through, they relay in the ventral posterolateral nucleus. Okay. Then motor control nuclei are ventro-anterior and ventro-lateral nucleus. Okay. Ventro-anterior, we will discuss, receives fibers from globus pallidus and substantia nigra. And ventral, and then it is given to the premotor area. And ventrolateral, they receive fibers from the dentate nucleus, dentatothalamic and cerebellum. And efferent fibers are given to area number 4 and 6. So that is motor control nuclei. Then visceral control nuclei means from viscera, this impulses are transmitted. One that is anterior nucleus, anterior group of nuclei. That is the part of the pathway of Pepys circuit that is important for memory and as well as emotions. And dorsomedial nucleus which has reciprocal connection with the prefrontal cortex. Prefrontal cortex, which is very important. Prefrontal cortex, that is in the here, anterior to the frontal areas, okay, motor areas, and that is very important for thinking. So it thinking, memory, judgment, and emotional behavior. So this decides the personality. So that is visceral control, dorsomedial and anterior group of nuclei. Then integrative and perceptual function control nuclei. Perceptual and integrative control nuclei. There one is pulvinar. Pulvinar receives fibers from superior and inferior colliculi, and efferent fibers I will discuss will be given to various lobes. Then lateral posterior and lateral dorsal nuclei. We will discuss one by one. Okay, now here this along with diagram we can see this all the nuclei you can see here. First of all, as I told you, nuclei anterior group, this is lateral, this is medial. Lateral is further divided into ventral and dorsal. Ventral is ventroanterior, ventrolateral, ventroposterior. So ventroanterior, this ventroanterior group of nuclei, they receive fibers, they receive afferent from globus pallidus, that is a part of basal ganglia, and efferent fibers will be given from here to the premotor cortex. Okay, and this is the relay center for the striatal impulses. Then ventrolateral, this is ventroanterior, this is ventrolateral. They receive fibers from the cerebellum to the red nucleus. Then they have been given here to the ventrolateral nucleus, and impulses are relayed in the premotor cortex. And this is a relay center for the cerebellar impulses. Okay. Now next is ventral posterior nucleus, this ventral posteromedial and ventral posterolateral. So ventral posterolateral, as we all know, all the tracks, ascending tracks, whether it is anterior, lateral, spinothalamic tract, or dorsal column medial lemniscus pathway, they all relay in this ventral posterolateral nucleus, and from this impulses are given to the sensory area. Here these are the sensory area number 3, 1 and 2 in the cerebral cortex. Okay, so it is a relay center for all these impulses from whole body except face and head. Face and head impulses, from the face and head the impulses are transmitted through ventral posteromedial. So here you can see this is your medial and spinal lemniscus from all the body. Another lemniscus is trigeminal lemniscus and solitary tract, solitary nucleus, okay, in the medulla. So from which impulses are given to the ventral posteromedial nucleus, and again from which impulses are given to sensory area 3, 1 and 2. And this is the relay center for sensory information from face, head, as well as solitary, that is solitary nucleus, tractus solitarius from medulla, that is concerned with the taste sensation. Okay, so this fibers sensory relay nuclei are your ventral posterior nucleus. Then comes anterior nucleus, this one here, anterior. So anterior nucleus receives afferent from the mammillary body. Mammillary body is a nucleus present in the hypothalamus. Okay, and efferent fibers are given to the cingulate gyrus. Here you can see. Okay, and from cingulate gyrus this will be given to the hippocampus, and from hippocampus again that will be given to the mammillary body, then mammillary body to thalamus. So this is this is known as Pepys circuit. I'll just draw it again. I'll show you. Mammillary body to thalamus, mammillothalamic tract, then thalamus anterior nucleus to cingulate gyrus to hippocampus again back to mammillary body. Okay, so this Pepys circuit is very important for attention, recent memory, and emotional behavior. Okay, now we discuss about this lateral nuclei, lateral dorsal, lateral posterior. This is here. We have discussed this part, ventral. Okay, now dorsal group, which includes lateral dorsal, lateral posterior, and pulvinar. So we will discuss this nuclei. So lateral dorsal, they receive afferent fibers from ventral tire nuclei of thalamus. I'll show you. Which one is ventral tire? Ventral tire means all this ventral, ventroanterior, ventrolateral, ventroposterior. So from this impulses are given here and here. Okay, so afferent from ventral tire nucleus of thalamus, and efferent is given to the precuneus and cingulate gyrus. Cingulate gyrus is here. We have discussed this one. And this is important for integration of sensory information, because from ventral tire nuclei sensory informations are coming and that is integrated here. Lateral posterior also has the same function. Afferent from the ventral tire and efferent is given to the superior parietal lobule. That is also important for integration of sensory information. Pulvinar, that is also afferent from ventral tire and efferent given to all the lobes, parietal, occipital and temporal lobes. And that is important for correlation of visual and auditory information with other sensation. Reticular nuclei, afferent fibers, they are given, they are going from the brainstem reticular formation, and efferent that is given to the whole cerebral cortex. These are your non-specific projection nuclei. Which are non-specific projection nuclei we discussed? Projection nuclei. They are anterior nucleus and we have discussed. Sorry, they are midline nucleus and centromedian nucleus. Anterior and dorsomedial, they are your perceptual control nuclei. Okay, we have discussed. Right? So, non-specific projection, anterior and dorsomedial, they are visceral control and perceptual control nuclei. Now, another is medial geniculate body. Here, this is medial geniculate body. Afferent fibers to the medial geniculate body, they will come from the inferior colliculus located in the pons, and efferent given to the auditory area in the brain, primary auditory area, and this acts as a relay center for the auditory information. Okay, the lateral geniculate body, that is relay center for the visual information. So this is lateral geniculate body here. Afferent fibers from the optic tract relay here, and then second order, third order neurons, they originate and they end in the visual area, that is area number 17, relay center for the visual impulses. Okay, so this is about all the connections of thalamus. Okay, now there are radiation. What do you mean by thalamic radiation? Thalamic radiation, they are nothing but collection of the fibers, you can see here like this, which connects thalamus to different areas of the cerebral cortex. Suppose if we are talking about anterior thalamic radiation, anterior thalamic means thalamus is connected to the anterior part, frontal. Okay, so frontal lobe, that is mainly concerned with your motor function. So motor control nuclei are connected here, and motor control nuclei are medial and lateral thalamic nuclei. Then superior thalamic here, superiorly. So superiorly, mainly here we have parietal lobe, we have sensory cortex. So the sensory cortex is connected with the ventral posterolateral ventral posteromedial nucleus of thalamus. So this is radiation is nothing but collection of fibers which connects thalamus to different areas of cerebral cortex. Then posterior thalamic, posteriorly we have occipital lobe which has visual area. So posterior thalamic radiation, obviously it is connected to your lateral geniculate body. Okay, and inferior thalamic radiation, because inferiorly here there is your temporal lobe. Okay, so inferior thalamic radiation, it temporal lobe has our auditory area. Okay, so auditory fibers, they relay in your medial geniculate body. So you can say that these impulses are connected, this radiation is connected to the medial geniculate body. Okay, so these are the thalamic radiation. Now we'll discuss about functions of thalamus. So first and foremost function, that is thalamus acts as a relay center. Everything will relay in thalamus and then only it will go to cerebral cortex, except smell sensation. Only smell sensation will directly go to the cortex. It has no relay in the thalamus. Okay. So it is a relay center for the pathway of somatic sensation, all the somatic sensation, but from opposite side of the body, as we all know that all the tracks they cross. Then impulses from cerebellum to cortex, as we have discussed. Okay, dentatothalamic tract, है ना? That is connected with the dentate nucleus, then to the red nucleus, then ventral lateral nucleus of the thalamus. Okay, we have discussed. So impulses from cerebellum to the motor cortex, then impulses from basal ganglia to, we have discussed basal ganglia part, that is globus pallidus here. Globus pallidus to ventroanterior nucleus here. Okay, so basal ganglia to cortex, that is also relay center, relay that will also relay the thalamus and then they can go up. Okay, then auditory visual pathway, auditory that is through medial geniculate body, visual through lateral geniculate body. Autonomic emotional reaction, because Pepys circuit. Okay, that is concerned with the autonomic emotional reaction, and reticular formation, non-specific relay nuclei, midline nucleus, okay, and centromedian nucleus, they are your non-specific projection nuclei, we have already discussed. Okay, just a minute. Non-specific are, I repeat, non-specific relay nuclei, they are your non-specific are midline and centromedian nucleus. Okay, so that is first function. It acts as a relay center. Second is thalamus is a center for the integration of sensory impulses, and not only it integrates but it determines the quality of the sensation, means which type of sensation it is. That is discrimination, means which type of sensation, from where it comes, means location, and other details of sensation, as well as affective nature, means whether the sensation is pleasant or not, it is good or not, pleasant or not, that is also decided by thalamus. Okay, this function is known as processing of sensory information. So thalamus is considered as functional gateway of the cerebral cortex. Okay, third function is integration of motor responses. Motor responses are also integrated because thalamus has connection with the cerebellum and basal ganglia, and because of this connection, thalamus acts as a center for the integration of motor responses. Then center for the integration of visceral and somatic information. So sorry, that is left. That function is left. Center for the integration of visceral and somatic information. Somatic and autonomic sensation. They are going to thalamus first, and then thalamus has connection with the hypothalamus mammillary body. So it also acts as a center for the visceral and somatic function. Also, thalamus has connection with the reticular formation, and because of its connection with the reticular formation, it is very important for arousal and alerting response. Okay, then it is also center for subcortical perception of pain sensation. This is one of the very important function. If suppose cerebral cortex is also not there and thalamus is available, then also pain can be perceived. Pain is very important sensation because it is a protective sensation of our body. Okay, so this is said called subcortical center for the pain sensation. Then center for reflex activity, because it has a sensory relay fibers, and motor responses are also given, so it is a center for the reflex activity. It is also center for recent memory and emotions. As I told you, it is a part of the pathway of Papez circuit. We have discussed thalamus, sorry, first is mammillary body to thalamus. Okay, anterior nucleus of thalamus, then cingulate gyrus to hippocampus, hippocampus again back to mammillary body. This is Papez circuit, which is important for recent memory and emotion. It is also center for speech because it has connection with the various cortical and subcortical areas which is required for the speech function. Okay, then a role in the arousal we have already discussed because of connection with the reticular formation. Also play an important role in the synchronization of EEG. EEG waves. If thalamus is not there, then these EEG waves are desynchronized waves they are found. So it plays an important role in the synchronization. I repeat all the functions. Let's repeat one, that is relay center for all the sensory information, motor information. Okay, integration of sensory information, integration of motor response, connection with the reticular formation, subcortical perception of pain sensation, reflex activity. It is center for memory and emotion, center for speech and arousal alerting response, and synchronization of EEG. All these are the functions of thalamus. Now lesion of thalamus we will discuss. Lesion of thalamus may be asked as a clinically a short note like thalamic syndrome. Other names for thalamic syndrome are Dejer-and-Rossi syndrome, thalamic hyperesthetic syndrome, thalamic pain syndrome, and central pain syndrome. Here, what is the cause of this thalamic syndrome? It is because of thrombosis of thalamo-geniculate branch of posterior cerebral artery. Okay, which supplies mainly nuclei supplied by this artery, thalamo-geniculate branch of posterior cerebral artery, that is postroventral. Sorry, nuclei are postroventral and posterolateral nuclei are affected. Okay, so what are the symptoms here? Clinical features, very important thing. First thing, that is effects on the contralateral side, opposite side. Suppose right side of thalamus is affected, all the symptoms are on the left side. Okay, symptoms are anesthesia, because postroventral nucleus is a sensory relay center, so all the sensations are lost. Person is not uh, getting or not discriminating all this sensation. Then second is astereognosis. Astereognosis means inability to identify the object by its size, shape, texture, etc. Okay. Then ataxia. Ataxia means lack of coordination, mainly sensory ataxia. Cerebellar also may be there because cerebellum has connection with the thalamus. So lack of coordination because of kinesthetic sensations are lost. Kinesthetic sensations are carried out by dorsal column medial lemniscus pathway. Then thalamic phantom limb. Phantom limb is person cannot locate the limb. Suppose left side lesion is there, person cannot find that this limb is available when eyes are closed. If eyes are open, person can see that the limb is available. Okay. Then hyperalgesia. Hyperalgesia means exaggerated pain sensation. Pain sensation is increased because this nuclei are damaged, posterolateral, postoventral. Then medial mass of the nuclei, they escape and they have hyperactivity that results in hyperalgesia. Okay. So these are the sensory symptoms. Then motor symptoms are the person is having ataxia. Motor symptoms because of posterolateral nuclei mainly affected, concerned with the motor cortex connection. So ataxia here because of damage to the cerebellar afferent. So cerebellar ataxia, cerebellar fibers are damaged. Okay. Then involuntary movements like involuntary movement present in your basal ganglia lesion like chorea, athetosis. This kind of movements are present. Chorea, that is quick jerky movement. Athetosis, that is slow writhing movement. Okay, as well as tremors are also present. Here tremors are intention tremor. Okay, thalamic hand, that is particular posture, abnormal posture of the hand. Here what happens, pronation of forearm, then flexion of the wrist joint, and then flexion at the metacarpophalangeal joint and extension at the interphalangeal joint, like this kind of posture is found. That is, you can see here, flexion at the wrist, flexion at the metacarpophalangeal and extension at the interphalangeal joint. This kind of posture is known as athetoid hand. Okay. So this is all about thalamic syndrome. Another applied aspect, that is Korsakoff syndrome. Here lesion is there in mid dorsal, so medio dorsal nucleus, and here the patient is having difficulty in remembering new information. So this is about the applied aspect of thalamus. So that's all about thalamus. If you wish to get all the PDF of all the topics, link for the same is given in the description box. Okay, thank you so much.